We will call to order the Health Subcommittee meeting, March 15th. Want to say first, the back wall is for members and the media and the members. So if you just leave that vacant for the members that are coming in for their bills. Madam Clerk, would you please call the roll?
Representative Boyd. Here. Representative Byrd. Here. Representative Freeman. Representative Hall.
Here.
Representative Jernigan. Representative Kumar. Here. Representative Marsh. Representative Sherrill. Here. Representative Terry. Here. Chairman, you have a quorum.
Thank you, Madam Clerk. Do we have any personal orders today, physician of the day or anything like that? If not, let's take care of a little bit of business first. We have some changes in the calendar. We have several bills that went off notice. Item 1, House Bill 2119 by Leader Lamberth has been taken off notice. Item 7, House Bill 2624 by Chairman Baum has been taken off. Item 8, House Bill 2081 by Baum has been taken off notice. Item 11, House Bill 2298 by Chairman Hostclaw has been taken off notice. Item 13, House Bill 2080 by Chairman Sexton has been taken off notice. Item 49, House Bill 2290 by Leader Gant has been taken off notice. We will move on to our corrected calendar. Item 2, House Bill 2096 has been rolled to the heel. What was item 3? Item 3, House Bill 2213 by Chair Lady Hazelwood. You're recognized. Have a proper motion and second on the bill. Are there any, I think we have an amendment on this bill.
Yes, there is an amendment. It is 013810.
Does that make the bill?
It in a way.
Okay. Let's go ahead. If no objections, we'll put the amendment on the bill. All those in favor of the amendment, say aye. Aye. Any opposition? We didn't get a motion and second on that. We did not. Let's go back just a moment. We didn't get a motion and second on the amendment. Stand for, have a motion. We have a second on the amendment. Have a proper second. We'll be voting to put the amendment on the bill. All those in favor say aye. Any opposition? So we're back on the bill as amended. You're recognized, Chair Lady Hazelwood.
Thank you, Mr. Chairman. And the amendment did rewrite the bill just to include some more participants in the task force that this bill would establish. And for as long as I've been in this legislature, we have dealt with the issue of reimbursement for those people, those folks who are caring for Tennesseans, like our developmentally disabled, like our elderly who are receiving care in their home through the Choices program, to keep out of the nursing home. We've just not been able to keep up reimbursement-wise to provide the kind of salaries that would allow those companies that employ these people to keep them employed, keep them taking care of Tennesseans. And I'm very proud of this legislature. You have supported me for 7 previous years. We have fought the good fight to get increased dollars for our DIDS workers. This year, the governor's taking care of that in his budget, but there are other folks out there who do care. They're contract employees that the state contracts with, both through TennCare and through various departments, who are, we're not probably reimbursing properly, and we're making it very difficult. And if we don't correct this issue, we're going to be having Tennesseans who are not going to be able to receive the services that we've promised them. So this bill simply sets up a task force made up of all the interested parties, various departments, that would look holistically at this reimbursement issue and develop a plan and a strategy for us to move forward so that we can continue to take care of the people in Tennessee that need these kinds of services. And with that, Mr. Chairman, I would stand ready for any questions.
Do we have any questions or comments on the bill as amended? If questions been called for, if there are no objections, we will be sending this bill to full committee. All those in favor say aye.
Aye.
Any opposition? So approved. Thank you, Chair Lady. Congratulations.
Thank you, Mr. Chairman. Thank you, committee.
Item 4, House Bill 2335 by Chairman Vaughn. You're recognized. Is he not here? Let's roll him down a space or two. We'll go to item 5. Senate Jordan Resolution 202. I think Representative or Chair Lady Helton. We have a proper motion and second on the joint resolution. Would you like to explain it to us?
Yes,
You're
Mr. Chairman.
recognized.
This resolution just encourages health insurers, providers, and hospitals to adopt the CDC hepatitis C screening guidelines to test all pregnant women in Tennessee for hepatitis C to help prevent the spread of new infections.
Okay. Do we have any comments or questions on the resolution? If none, we'll be voting to send this to full committee. All those in favor say aye.
Aye.
Any opposition? So approved.
Thank you, Mr. Chairman and committee.
Thank you. Item 6, House Bill 2649 by Chairman Williams. You're recognized. We have a proper motion and second on the bill. Did we have an amendment on the bill?
We do have an amendment, drafting code 0125902.
Okay. Okay, that, yeah, we're okay with that. That's the original number. So we have a proper motion and second on your bill. Would you like to explain it to us?
Yes, sir. Chairman and members, this bill would allow Erlanger Hospital to hire its own private security guards because of the shortage in law enforcement in the Chattanooga area. Even in my district, there has been an incident where law enforcement is needed. Currently, because of this shortage, Erlanger is not able to get the security from law enforcement that they need. This bill would allow them to do that in the Chattanooga area. Senator Watson asked me to carry this bill on the House side, so that's why I'm here. Happy to answer any questions the members may have.
Sure. Do we have any questions or comments on the bill? Yes, Speaker Marsh.
Thank you, Mr. Chairman. Can they not already hire security guards? That's against their regulations?
They can hire security guards, but with this bill would allow them to be able to have limited power as it relates to an arrest or detaining someone. Currently, they can have security as it relates to monitor the doorways, but they don't have the ability to detain anyone. This
Okay.
would give them the ability to do such.
Speaker Marsh. Okay. We have further comments or questions on the bill? If none, we will be voting to send this bill to the full committee. All those in favor say aye.
Aye.
Any opposition? So approved.
Thank you, Chairman and members.
Thank you, Chairman. We have item 9, 2500 by Chairman Boyd. You're recognized, sir, I think in your seat. Second. Have a proper motion second on the bill. And there is an amendment, I think.
Yes, Mr. Chairman, I'm showing drafting code 014217.
And it makes the bill, ask for a motion and second on the amendment. We have a proper motion and second on the amendment. We'll be voting to put the amendment on the bill. All those in favor say aye.
Aye.
Any opposition? So approved. We're back on the bill as amended. If you'd like to explain the bill.
Thank you, Mr. Chairman. This bill, as amended, would transfer the Board of Licensing for healthcare facilities from the Department of Health to the Health Services Development Agency, which would be renamed the Health Facilities Commission. Mr. Chairman, I'll take any questions.
Do we have any questions on the bill as amended? If, and the question's been called for, if there are no objections, we'll be voting to send this bill to full committee. All those in favor say aye. Any opposition? So approved. Thank you, sir. We move on, and we've been requested to jump around to specific items here. We'll take up item 12, House Bill 2207 by Representative Hicks. You are recognized, sir. Okay, I think you have an amendment on the bill.
Thank you, Mr. Chairman, I do. Drafting code 013779.
Have a proper motion and second on the amendment. The amendment does make the bill. We'll be voting to put the amendment on the bill. All those in favor of the amendment say aye. Any opposition? We're back on the bill as amended. You're recognized on the bill.
Thank you, Mr. Chairman. House Bill 2207 was brought to me by the Tennessee Psychological Association. Once a prospective psychologist has finished their 4 years of PhD classwork, they must complete a 1-year postdoctoral training under the supervision of a licensed psychologist and are granted a 1-year provisional license while engaged in such. If an individual does not take and pass the national exam or jurisprudence exam during this postdoctoral year, then they can obtain a temporary supervised license for a maximum of 1 year after they finish their postdoctoral requirements. This bill, as amended, would allow a candidate who fails the national exam to take an exam a second time while they have a temporary license. It would not extend the 1 year they can have a temporary license. This bill would also allow 30 days after the second failure for both provisional and temporary licenses for the licensee and the supervisor to transfer the care of patients they are seeing before their license is revoked. So that's the bill. I'll be happy to answer any questions.
Yeah, I think we've had a request for testimony from Mark Green on this bill.
Mr. Chairman, I think it's only if needed.
Okay.
I would ask for passage.
That'll be fine. Do we have any comments or questions on the bill as amended? Dr. Kumar, you're recognized.
Thank you for bringing this. It's helping the professionals. But what is the current process? What happens now if they don't pass the exam? What is the current process compared to what you are proposing?
Chairman Hicks.
I believe the process now is they wouldn't have the 30 days is the big part of this bill is to extend that 30 days so they can transfer the care to the other patients if they don't pass the test.
Dr. Kumar.
Now, the temporary license is good for 1 year.
Chairman Hicks.
Thank you, Mr. Chairman. Yes.
And if they fail the second time, then what happens?
Chairman Hicks.
Thank you, Mr. Chairman. If they fail the second time, then they have a 30-day extension to pass the care to a different physician, a different psychologist.
Dr. Kumar.
Do they still continue to practice?
Chairman Hicks.
No, I believe it's the 30 days are just to transfer the care.
Okay, right. If they've transferred the care, they're not continuing to practice. Thank you, Mr. Chairman.
Do we need further discussion? We have expert witness if anybody requires it. If none, we'll further questions or comments on the bill as amended. If none, questions have been called for, no objections, we'll be voting to send this bill to full committee. All those in favor say aye.
Aye.
Any opposition? So approved.
Thank you, Chairman. Thank you, Committee.
Thank you, sir. We're going back to item 3-4, House Bill 2335. And Chairman Vaughn, you are recognized on the bill. Have proper motion and second on the bill. I think there's an amendment.
Yes, sir, Mr. Chairman, there is, and the amendment makes the bill.
Have proper motion and.
The amendment is 15875, yes.
Do we have a second on the amendment? Second. Okay, proper second on the amendment. We'll be voting to put the amendment on the bill. All those in favor say aye. Aye. Any opposition? So approved. We're back on the bill as amended. You're recognized.
Thank you, Mr. Chairman, and I must say, I'm glad to see this bill has brought out all these people.
Oh, yeah. I do.
You all get shiny faces, smiley faces on your report card today, and by the way, it's VAUGHAN.
Yeah.
For those of you in the media types.
You can see it on the statue in the hallway.
Thank you, Mr. Chairman. What House Bill 2335 purports to do, or what we're proposing with it, is a few years back we brought forth an OBOT buprenorphine bill, which allowed nurse practitioners, advanced practice registered nurses, to participate in the issuance of prescriptions for buprenorphine. What this bill does, at that point in time, we wanted to see how it went. We limited the prescriptive authority of those people to 100 prescriptions. What we have done is, since that time, the feds have raised that limit to 275. This bill would also raise that limit from 0 to 275. It also regulates the use of telemedicine for MATs utilizing buprenorphine. I'm trying to say that as many times as possible. I might get it right one time. To ensure patients are receiving the necessary wraparound behavioral health systems, and curb diversion by requiring that providers must have a physical clinical setting in order to prescribe buprenorphine in Tennessee. And I think that's a very critical aspect of it. I talked to my colleague, Representative Hicks, who was here before me, and he had expressed some interest with regards to that, because that we are a little bit concerned about telemeds in buprenorphine prescription settings, and this takes care of it within the OBOTs. And so with that, I'll be happy to answer any questions.
Okay, do we have any questions, Dr. Terry?
Thank you, and I just want to commend the sponsor of the bill. A few years ago when you brought the original legislation, working with the committee and getting it right, and I think we were probably ahead of the curve, and as Tennessee often is, and now you've brought back something that helps in this situation. So again, I just want to commend you for your work on this.
Thank you, sir. Appreciate that.
Do we have further comments or questions on the bill as amended? Question been called for. No objections. We'll be voting to send this bill to full committee. All those in favor say aye. Aye. Any opposition? So approved.
Thank you, sir. We appreciate it.
Yes, sir. We'll get that spelling right next time. We'll move on to item 10, which is House Bill 2376 by Chair Lady Littleton. We have a proper motion. Do we have a second? Second on the bill. We have an amendment that makes the bill. Do we have a motion and second on the amendment? Have proper motion and second on the amendment. We'll be voting to put the amendment on the bill. All those in favor say aye. Aye. Any pardon me. Yeah. Would you repeat the drafting code for us, Chair Lady?
14951.
Okay, so we're voting to put the amendment on the bill. All those in favor say aye. Any opposition? So approved. We're back on the bill as amended. If you'd like to explain the bill.
Thank you, Mr. Chairman. The bill as amended would require an annual reporting to the legislature of the data collected by the Department of Mental Health and Substance Abuse related to the use of medication-assisted treatment of opioid addiction. The opioid addiction problem in our state is and has been an epidemic for many citizens in our state. Its impact reaches far and wide and oftentimes deep into families. As the state is receiving more dollars through the opioid abatement funds and other grants, it is important that we, as a General Assembly, know how these dollars are being spent on medication-assisted treatment. We want to make sure that we know how the dollars are being used, what wraparound services these patients are receiving, and make sure that we are spending dollars towards the most effective means of treating opioid addiction, not spending dollars on anything that is making the problem worse.
Okay, great explanation. Do we have comments or questions on the bill from the committee? Question's been called for on the bill as amended. If there are no objections, we'll be voting to send this bill to full committee. All those in favor say aye. Aye. Any opposition? So approved.
Thank you, Mr. Chairman and Committee.
Thank you. Okay, as I say, we've been requested to jump on particular items. We'll be on item 31 here. House Bill 1999 by Chairman Jernigan. You're recognized. We have a proper motion and second on the bill.
Chairman, I think I have an amendment that makes the bill.
Okay. Would you give us the code?
I have 14927.
That seems to be verified, so we'll want to put the amendment on the bill. We'll be voting to put the amendment on the bill. All those in favor say aye. Any opposition? So approved. We're on the bill as amended. You're welcome to describe the bill for us.
Thank you, Chairman, members. This bill, as amended, directs the Tennessee Board of Pharmacy to promulgate rules that will ensure an individual who's visually impaired will have appropriate access to prescription labels and related materials appropriate to their needs. An example of what an accessible label can do, it can inadvertently prevent someone from taking the wrong medication, taking the wrong amount of medication, administering medication at the wrong times, accidentally taking outdated medications, taking medication not in accordance to printed instructions, and being unable to detect pharmacy errors. So with that, I'm happy to answer any questions, Mr. Chairman.
Do we have any questions or comments on the bill as amended? If none, you did such a great job, sir. We'll be voting, if no objections, we'll be voting to send this bill to full committee as amended. All those in favor say aye. Aye. Any opposition? So approved.
Thank you, Mr. Chairman, members.
Thank you, sir. We will go to item 37. I think Representative Hakeem, you are recognized. Have a proper motion and second on the bill. And we have an amendment that, does that make the bill? Does the amendment make the bill?
Yes, sir.
Representative?
Yes, sir.
Okay, if you just give us the code.
We need a motion second.
Okay.
14708.
14708, is that correct?
Yes, sir.
Okay, great. We have a proper motion and second on the amendment. We'll be voting to put the amendment on the bill. All those in favor say aye. Aye. Any opposition? So approved. We're back on the bill as amended. If you'd like to describe the bill to us, Representative Hakeem.
Yes, sir. I'll be very brief, Mr. Chairman. The bill requires the Department of Health to continue to utilize remote use of the Special Supplemental Food Program for Women, Infants, and Children, WIC program, at a similar level that has been available during the years 2020 and 2021 and 2022. Requires DOH to conduct a review of remote use of the WIC program and report findings to the chairs of the General Assembly, Health Committees no later than December 15th, 2022. The program has worked very well, sir. The department has worked very well in doing the remote, and it's been great for both our department and the recipients.
Thank you, sir. Do we have any testimony? No. Okay. Speaker Marsh, you're recognized.
Thank you, Mr. Chairman. And Representative Hakeem, I understand from the department that the federal government gave us a waiver to be
Yes, sir.
able to do this.
Yes, sir.
Representative Harkey.
and that we cannot continue to do it unless the federal government continues to give us this waiver. So I guess if they don't give us the waiver, then we can't do this. That's the way I understand it.
Representative.
I don't see a problem with the waiver, sir, going forward, because looking at the efficiencies and what has happened to benefit the recipients as well as the department, I don't see us having a problem in regards to the waivers.
Speaker Marsh. Okay. We have other comments or questions on the bill as amended? If none, we will, Chairman Terry, you're recognized.
Thank you. And just to clarify that, it says as allowed via federal waiver, they may utilize, and so that's in section 1. And I just want to commend you. You came to me early on this session and been working on this, and just want to thank you for your patience and your work on this. And I think that when they do this review, they're going to see that it was beneficial, and hopefully they will listen. Thank you.
Representative Hakeem.
Thank you, Mr. Chairman.
Further comments or questions on the bill as amended? If none, we'll be voting to send this bill to full committee. All those in favor say aye. Aye. Any opposition? So approved.
Thank you, Mr. Chairman and members.
Thank you, sir. We are moving to item 39, House Bill 2849 by Dr. Kumar. Okay. Have a proper motion second on the bill. We have an amendment that makes the bill. Have proper motion. Do we have a second? And a second on the amendment. We will go ahead and put the amendment on the bill. All those in favor of the amendment, do we have the number on it?
13746.
Is that correct? Okay. That corresponds. All those in favor say aye.
Aye.
Any opposition? We're back on the bill as amended. Dr. Kumar, you're recognized.
Thank you, Mr. Chairman and committee. This bill provides a short-term license to practice in the United States for visiting foreign medical graduates who are here for specialized training. The duration of the license is 90 days. There is required proof that the person is a graduate of a recognized medical school. They have written acceptance to a clinical professional development program in the United States. They have lawfully entered the United States, and their credentials have been verified. And they work under supervision. This license cannot be used for other purposes, such as go into private practice or enter a residency program. Again, this is a short-term 90-day license for a visiting medical graduate from a foreign country for 90 days.
Okay, do we have comments or questions on the bill? Dr. Terry, you're recognized.
Thank you, and I do want to, again, keep repeating myself, but I do want to thank the sponsor of this bill and those that brought him this bill for working on it. And there is a need out there. There are physicians out there in this position that could come in and be supervised like at Vanderbilt or other clinics, and so this is needed, and so I do appreciate the sponsor for bringing it and those that worked on this that brought him this legislation. Thank you.
Thank you.
Other comments, questions, or accolades? I too thank you for bringing this bill. It's very important. If none, we will be voting to send this bill as amended to full committee. All those in favor say aye.
Aye.
Any opposition? So approved. We'll move on to item 40 by Dr. Terry, House Bill 2559. We have a proper motion second on the bill. We have an amendment that makes the bill. If you'd give us the code, sir.
Amendment 014257.
Okay. We'll be voting. Do I have a proper motion second on the amendment? I think we do. We will be voting to put the amendment on the bill. All those in favor say aye.
Aye.
Any opposition? We're back on the bill as amended. You are recognized, sir.
Thank you, Chairman Committee. This bill as amended will modify the existing guidelines for drop-in child care centers to meet the needs of working parents. Under current law, A child may be placed in a drop-in child care center for a maximum of 7 hours per day, 14 hours during regular weekday business hours, and then a total of 20 hours maximum per week. This bill, as amended, will increase the maximum daily hours to 9 per day and a maximum weekday business hours up to 18 to accommodate the average workday of 8 hours and then a commute to and from the center. The maximum total will stay at 20 hours.
Do we have comments or questions on the bill as amended? If none, we will be voting to send this bill to full committee. All those in favor say aye.
Aye.
Any opposition? We're sending it to full committee. Thank you, sir.
Thank you, Chairman Committee.
Saw Representative Beck come in. We're on item 34, House Bill 686. We have a proper motion and second on the bill. Do we have an amendment on the bill?
We do, Mr. Chairman, and it just changes the effective date to July 1, 2022.
Okay, we have proper motion and second on the amendment. Any questions or comments on the amendment? Drafting code 15087.
Correct.
Okay. All right. So all those in favor of amending the bill as stated, say aye. Any opposition? We're back on the bill as amended. Yes, sir, you're recognized.
Thank you, Mr. Chairman. And, Mr. Chairman, this was a bill that was brought to me by a constituent, and she was here 2 weeks ago but could not be here today. And I'd just like to read a statement from her real quick. Her name is Nancy Harvey, and she'd like to address the committee. I have a serious allergic to peanuts my entire life. My doctor has advised me to keep dual EpiPens with me at all times because of my severity of the allergy. Despite my due diligence, I have inadvertently come into contact with peanuts or peanuts products and get an allergic reaction. I have been instructed to use the pen immediately when I get a reaction. If it hasn't worked in 15 minutes, I am instructed to use the second pen due to my severity of my reaction. In the instance where this happens over a weekend, if I'm out of refills, I'm unable to get more EpiPens. I have to solely rely on ambulances or getting to an ER to treat my reaction. If the bill passes, I would be able to go to the pharmacy and get an EpiPen to protect me until my doctor's office is open and I'm able to write a prescription. If Narcan can be free and available to everyone who asks, then someone should, who needs an EpiPen should also be able to get one. What this bill does is it authorizes the chief medical officer to implement a statewide collaborative pharmacy practice agreement specific to dispensing of EpiPens, auto-injectors with a licensed practicing pharmacist if there is already a prescription for an EpiPen on file. So it's not a new prescription. And with that explanation, I stand prepared to answer questions, Mr. Chairman.
Do we have any questions or comments on the bill? And I think that is the posture of the naloxone. It's on a standing order written by the Department of Health. And so this is similar, but having a previous prescription for it. Differs in that. Yes, you're recognized.
And that's correct, Chairman. There has to be a standing prescription already for the EpiPen, and this would avoid someone who has an allergy from running out an EpiPen on weekends or holidays when they can't get a hold of their doctor's office to get a refill.
Okay. Any comments or questions on the bill? We have questions been called for. If there are no objections, we'll be voting to send this bill as amended to full committee. All those in favor say aye. Any opposition? So approved.
Thank you, Mr. Chairman and committee.
Thank you, Representative. We will go to item 23.
That's House Bill 2545.
Okay, that's House Bill at 2545 by Representative Alexander. And you are recognized on 2545. I think it has an amendment that makes the bill. Okay. We need a motion and second on the bill. Have a proper motion and second on the bill. And we need a motion and second. Would you give us the code on the amendment, please?
Yes, thank you, Chairman. The code on the amendment is 014916.
That's it. We have asked for a motion. We have motion, and do we have a second on the amendment? I have a second. All those in favor of amending the bill with this amendment, say aye. Any opposition? We're back on the bill as amended. You are recognized, Representative Alexander.
Thank you, Chairman. Tennessee has had certified medication aid programs for more than a decade. It's called a CMA. The bill updates the current statute to make the program more accessible to more certified nursing assistants by adding flexibility in content delivery and expanding the pool of candidates. Research shows that the use of medication aids can improve the efficiency of licensed nursing staff for RNs and LPNs of a long-term care facility by affording the nurses more time to perform assessment of residents with changes in condition and more time to provide critical care. Use of the CMAs is associated with a heightened job satisfaction for overburdened nursing staff and offers career mobility for certified nursing assistants, CNAs, by creating an intermediate position that facilitates career growth and earning potential. That is my bill.
Okay. Do we have any comments or questions on the bill as amended of the sponsor? If none, we will be voting to send this bill as amended to full committee. All those in favor say aye. Any opposition? So approved. You are recognized on item 24, House Bill 2535. It also has an amendment, I think. Does the amendment make the bill?
That is correct, sir.
Just, if you would, give us the code.
014796.
Okay. So I thought we had a motion and second on the bill. This chair will stand for a motion and second on the bill. Have a proper motion. Do we have a second? Have a proper second on the bill. Do we have a proper motion and second on the amendment? Have a motion and second on the amendment. We'll be voting to put the amendment on the bill. All those in favor say aye. Any opposition? So approved. Representative, you're recognized on your bill as amended.
Thank you. This bill as amended ensures the right to the end-of-life visitation during a disaster, emergency, or public health emergency such as COVID-19. The amendment removes the specific requirements to provide a negative test for the visit. Nursing homes must always allow indoor visitation as it is a resident's right. The federal government closed the facilities to indoor visitation for more than a year during the pandemic, but still allowed end-of-life visitation. Prior to COVID, nursing home visitation was always open. Facilities are largely back to normal visitation. Facilities cannot limit the frequency and the length of the visits, the number of visitors, or require advanced scheduling. Facilities must always allow end-of-life visitation. Visits must adhere to the CMS infection control protocols like hand washing, face coverings in common areas, as well as other required safety protocols. Visitation is also subject to the resident's choice as to who can visit, the timing for that visit. Visitation must also be safe for the resident, the roommates, and other residents in the building, and that is the bill.
Okay, we have heard the description of the bill as amended. Do we have comments or questions of the sponsor? We have Speaker Marsh. You're recognized.
Thank you, Mr. Chairman. And I understand why you're doing this, and I think it's a great program. What certain conditions are required? I mean, can the nursing home or the facility ban somebody from coming in?
Representative Alexander.
Well, I think it would, you mean like if they're not wanted by a visitor or?
Well, there's
what do you
Speaker
mean?
Marsh.
not necessarily by the patient, if they're just, the nursing home or the facility feels like it's a bad guest for some reason or another.
Representative.
Do they have to be a family member, I guess, or they have, what is the requirements?
I don't know that they have to be a family member. I go visit people all the time in nursing homes that are not kin to me in any way. So this was just ensure that during the pandemic that we could still have people, and it is for end of life. Representative Marsh, it's for end of life.
It only end of life?
Yes, sir.
And it's only during pandemic?
Yes, sir.
Representative.
Okay. Thank you very much.
Sorry, Chairman, I was out of order.
Oh,
Sorry.
no. We have Representative Freeman, you're recognized.
Thank you, Chairman. And this may be somewhere, and I'm just not seeing it. What is the definition of end of life?
Representative.
I'm assuming that is up to the physician, sir.
Representative Freeman.
So there's no definition. It'd just be whatever? You can just have anything as considered end of life?
Well,
Representative, and if you're having difficulty, we can go out of session at any point and ask legal to define that for us. But go ahead, you're recognized.
that would be great.
So any objections, we'll go out of session and ask legal to give us a description or definition.
Rajul Bajoy, Office of Legal Services. As I understand it, your question, Representative Freeman, is whether there is a definition for end of life. The bill does not define end of life as a term, and there is no definition of end of life in the code. So it would be up to the nursing home or a court interpreting the statute.
Representative.
I have a question back there.
Okay. Any questions of our testimony here? If none, we'll go back into session. And Representative Freeman, you're recognized.
Thank you, Chairman. And I too appreciate what you're doing. I've got family members in assisted living facilities, and it was absolutely heartbreaking to go visit them and have to wave through the window with my kids, and but also fully appreciated the facility keeping people out to ensure that my loved one was kept safe. And having no definition of end of life seems that it could be really taken advantage of. Is this something you'd be willing to roll and work on that definition?
Representative Alexander.
That would be fine with me.
Okay.
Is that a motion?
I make that motion.
Representative Jernigan or Chairman Jernigan?
Do we roll to the heels in just the last calendar, or how does that work?
That would be my estimation of what your motion was.
Yeah, that'd be my motion. Thank you.
Yeah, I'll second
Dr. Terry, you're recognized.
I don't know if I can speak on the motion. I would argue against the motion. I would be more in favor if she was going to amend it. We've done this with actually the bill that I'm carrying that's in full committee, and we changed the term from terminal to critical, and then I defined that. That's an amendment that we will see in full committee tomorrow, and I think that could easily be amended. So,
So you're recommending that we pass this bill and amend it?
That would be my.
According to your.
I would be good with that, is what I'm saying.
Okay.
But it's the will of the committee.
I retract my motion. That would be fine.
You retract your second as well? Yeah. Okay. Okay, so the posture here is that we want to continue the discussion and with the interest of maybe defining end of life a little more specifically. Who else was it? We're back in session, yes. Chairman Jernigan, did you?
When you say the pandemic, is that just COVID-19 or any pandemic?
Representative Alexander?
My understanding it's for COVID-19, sir.
Okay, thank you.
we have further comments or questions? Now, we are in the process of moving this forward to full committee. So your questions, maybe the distinctions can be made. We have further comments or questions of the sponsor. The bill is amended. If none, we will be voting to send this bill to full committee. All those in favor say aye. Any opposition? So approved. You, Representative Alexander, you're recognized on number 25, House Bill 2778. We have two amendments. Okay. My understanding is there are two amendments that make the bill, so I would ask that you pick one of them and give us the code.
Okay.
We have a second on the bill. We have a proper motion. Do we have a second on the bill?
014643.
Okay. We have noted that. Do we have a motion and second on the amendment? Have a proper motion, a second. Does anybody give a second on the amendment? Second. Okay, so we are on the amendment. We'll be voting to put the amendment on the bill. All those in favor say aye. Any opposition? So approved. Okay. We're back on the bill as amended. If you'd like to explain the new amendment.
This is a hospital visitation bill, and I'd like to tell you about what happened in my area. I get down here for session, right before session, I get a text message about 3 days before from a woman who pleaded with me to help her. Her father was in our hospital, one of our hospitals in Johnson City. He was, had COVID in both lungs, but he was not in intensive care. But he was very frightened to be in the hospital with COVID, as you can imagine, and he had panic attacks. He asked the hospital she asked the hospital if her mother could be with her father while he was having these panic attacks. The hospital said that she could only be in there for 2 hours instead of 8, which is what they requested. And so she reached out to me and said, "Can you help me? My father's having panic attacks. He needs my mother with him." So I reached out to the hospital. The hospital said, "Well, our policy is only for 2 hours." And I said, "Can you tell me why a person can only be in there 2 hours when, if you're worried about spreading COVID, exposure in 2 hours would be just as much exposure as if they were in there 8 hours? So why not let them stay 8 hours?" And they said, "Well, that's just our policy, and we can't do for one patient what we do for another." Several days went by. The man kept having more panic attacks. And the first original text was on Thursday. And by Monday, I got a text that the father had died of a heart attack during a panic attack. So our hospital has since changed the policy because of what happened to this man. And I'm asking that we change the policy for all hospitals, that we allow people in to visit their patients, that every patient has a right to have one advocate with them at all times. And that advocate could be a family member. Sometimes people have no family members, and then they are appointed a caregiver, and sometimes it has to be a caregiver. It would be at least one person with them at all times. This is not just for COVID. It is not just for a pandemic. It's for all times. We as people who are entering hospitals are paying huge hospital bills, and we should be allowed to have an advocate with us at all times. Besides that, we are short nurses. We are short caregivers. If we can have someone in the room that could hand us a cup of water, would save a nurse's trip into that room, what a benefit that would be for the hospital. It is not for end of life, because my friend in Johnson City's father was not at the end of life when he entered the hospital. and that's why the bill is like it is. It does protect intensive care. Lots of things occur in intensive care, and I think hospitals have a right to adjust that. That is my bill.
Do we have, I have a request for testimony, but first let me open the committee to questions or comments on the bill from the members. If none, we will, no objections, we'll go out of session and have testimony, I think, from the Tennessee Hospital Association.
Sure.
Thank you, Mr. Chairman. Thank you, committee, and thank you, Representative Alexander. My name is Lacey Blair, and I'm with the Tennessee Hospital Association. We thank Representative Alexander for many conversations with us on this issue and for allowing the hospital the benefit of being able to treat her patient and get the family in there. The way that we are opposed to her bill, the way that, with the amendment on, the way that it's written, because it goes beyond just the COVID-19 pandemic. And we have federal laws and rules and regulations that are already in place that allow family members and that allow caveats in that those policies for situations where you've got to protect patients and employees with infection control procedures and whatnot. There is legislation that is traveling through the process that is related to the COVID-19 pandemic and end of life that clarifies some legislation that was passed back in October specific, and I believe Representative Chairman Terry did mention a bill that was passed out of this committee just last week. We are happy to continue to work with Representative Alexander and the committee, but also make sure that we are allowed to protect patients when they are in our facilities and to protect our employees and do what's best for local communities in these situations. Thank you.
Do we have comments or questions to the testimony? Chairman Jernigan, you're recognized.
You'd mentioned you have to follow federal law, right? That's
Ms. Blair.
correct?
Yes,
That's
sir.
And so, in Representative Alexander's amendment, it said that you would not have to follow that if it violated any federal or state law. So I think she's exempted that part. Is that right?
Ms. Blair.
Yes, sir, that is in the legislation. Our opposition really stems from this would be the first time that anything beyond pandemic related is put into state code around visitation, and it could actually have some type of potentially negative impacts in the future by hospitals restricting visitation policies potentially if something is in state code. So we like to, obviously like to keep that ability open if necessary and out of code if possible.
Chairman Jernigan.
The way I read it, it says if it wouldn't apply if it federal state code or federal state law applied. So I just wanted to ask you that question. So just because it's the first time doesn't mean that it's a bad idea. So thank you, Chairman.
Okay, do we have further comments or questions in testimony? Speaker Marsh, you're recognized.
Thank you, Mr. Chairman. And I'd like to ask, I don't know how this would work, but if they did have a visitor who ended up being very argumentative and very combative, is there already rules that you could have that person removed, or would this law supersede that?
Ms. Blair.
Representative Marsh, that's a really good point. I believe that you would still be able to use any type of safety protocols that you have in place. So if you had a patient's visitor was being combative, I believe security would still be able to remove them, if that answers your question.
Speaker Marsh. Have further comments or questions of our witness? If I see none, so if none, we'll move back into session. Thank you very much. And any comments or questions from the sponsor or the committee members? Chairman Terry, you're recognized.
Thank you, and I'm just getting clarification on the safety protocol. So if this, again, safety protocols isn't necessarily defined, and it's up to the hospital I guess, in the way this is worded, to their safety protocol. So if they established something that said a time limit at like 10 o'clock at night or 9 o'clock at night, because you have some members or some patients that may have Alzheimer's or something where they can get confused with people walking by the door, something like that, would that be a safety protocol that they could establish to where they could put a time limit?
Absolutely.
Representative?
Yes.
All right.
Oh, I'm sorry. Sorry, Chairman. Yes.
All right, thank you.
Further. Let me go out of session here just a minute, and we do have a correction from our legal analyst.
Rajul Bajoy, Office of Legal Services. In regards to the previous question, the text of the bill states that the patient representative has to agree to follow all safety protocols established by the hospital, which shall be clearly specified in writing and be no more restrictive than the protocols applicable to the staff of the hospital. So in regards to visitation hours, those protocols would also have to apply to the staff of the hospital.
Do we have any questions on that answer? Chairman Terry, you're recognized. We're still out of session with the witness.
Yeah, thank you. So to that point, if the hospital said that the staff could not visit after hours, then it would apply to the staff as well.
Mr. Bajoy.
Yes, I believe so.
Thank you.
Representative Freeman, you're recognized.
So I just want to make sure that I understand. So does that mean that if a doctor or nurse doing rounds were to come in and check on the patient at midnight, that would count, and they could allow patients in at the, visitors in at the same time?
Mr. Bajoy?
So this would be a fact-specific question dependent on what the hospital safety protocols are. So I'm not entirely sure in that scenario where that would fall, because it would depend on the safety protocol itself.
Representative Freeman?
No.
Okay. Further comments or questions of our expert witness? Yes. You want to go back? Okay. So no further questions. We'll go back into session, and we have a question, Dr. Kumar, of the sponsor.
Thank you, Mr. Chairman. Thank you for bringing this. It's an important matter, and certainly there are times their families are a great deal of support, especially with the nursing shortage and so on. One question was that, I don't know, would it get overread in the sense that there are times where a patient is having a bedside procedure in the room and so forth? Is there an exception for that? We can ask the family to step out?
Representative?
Yeah, I'm sure that the hospital could ask the family to step out. I've been in that kind of situation with my father before, where they were going to do something, a procedure on him, and they just asked to step out. And most families oblige that. That's
sure. Well, they
Kumar.
do. Thank you. They do, but so if the hospital has policies that they would ask them to step out, of course, you've exempted the intensive care unit, again, for the same reasons. Those procedures will still apply.
Representative?
Yeah.
Thank you, Chairman. Yes, that would still apply.
Thank you, Mr. Chairman.
Doctor?
Thank you.
We have further. Chairman Byrd, you're recognized.
Thank you, Mr. Speaker. And I just wanted to say I appreciate you bringing this. Of course, I just had some experience being in the hospital with COVID and really never knew what panic attack was until after I received COVID. And believe me, it means a big difference when you can have a family member with you, because that can definitely mean the difference between life and death, I think.
Yes.
So I think this is definitely needed. Appreciate it.
Thank you, Representative.
Thank you, sir. Representative, did you want to comment? Do we have further comments or questions from the sponsor? If none, we will be voting to send this bill as amended to full committee. All those in favor say aye. Aye. Any opposition? So approved. You're up for number 26, House Bill 2779. You are recognized. Okay, we'll stand, the chair will stand for a motion and second on the bill. Do we have a proper motion and second on the bill? We do have an amendment that makes the bill. If you'd give us the code, please.
Yes, 014159.
We got it, and you are recognized. We have a motion and second on the amendment. Have a proper motion and second on the amendment. We'll put the amendment on the bill. All those in favor of the amendment, say aye. Any opposition? We're back on the bill as amended. You are recognized, Representative Alexander.
This bill is modeled directly after the legislation passed in Texas last year. Abortions, since that bill has been passed, has dropped 60% in Texas since that bill was passed. While the Texas law prohibits abortion once medical professionals can detect cardiac activity, usually around 6 weeks, the Tennessee language proposes to prohibit all abortion. Courts have blocked other states from imposing similar restrictions, but this law differs significantly because it leaves enforcement up to private citizens through civil lawsuits instead of criminal prosecutors. The Texas Supreme Court recently upheld this bill, ensuring this bill remains in the Texas law for the unforeseeable future. This is my bill.
Okay. We have questions or comments on the bill as amended. I think Representative Freeman, you're recognized.
Thank you, Chairman. So the civil procedure, as I'm reading it, there's a minimum $10,000 fine. Is that correct,
Representative? Yes.
That is correct.
And who can bring a suit for it or a case? How does that work? Do they have to be injured? Do they have to have standing in the case?
It can be any citizen.
Any citizen. So you could have a rapist. 1 in 5, maybe 1 in 6 women in Tennessee are victims of rape. And you could have a rapist, and that rapist could impregnate a young lady, a minor, and the rapist's mother or father could bring suit against that minor if they decided to get an abortion, if this passes.
Representative?
The bill states that a rapist, sexual assault, or incest cannot bring a charge against the woman that is harmed.
So,
Representative Freeman?
That wasn't the question I asked.
I'm sorry.
I asked if their parent, sibling, friend, neighbor, spouse could bring suit against the minor who was raped to force them to pay a $10,000 fine if they decide to have an abortion.
Representative?
Can we go out of session for legal to specify that?
Any objections? We'll go out of session. Representative Freeman?
I would appreciate the sponsor's opinion.
Would you have an opinion?
My assumption is that they could, because it's any citizen.
So yes,
other than the rapist.
I don't need to go out of session.
Okay.
I think that's actually think the correct answer.
Okay. Do we have comments or questions on the bill as amended? We have had a request for testimony. Dr. Aaron Campbell is, if we don't have any questions for the sponsor at the moment, is Dr. Aaron Campbell here? Any objections? We'll go out of order. I mean, out of session and hear the testimony. No objections? We're out of session and we will try to stay in order. Sir, if you'll just introduce yourself. You have 3 minutes.
Thank you, Mr. Chairman. Thank you, representatives. Thank you, Representative, for hearing us today. My name is Aaron Campbell. I'm a physician from Knoxville. I grew up in Knoxville, Tennessee, went to Farragut High School, University of Tennessee, where I majored in biochemistry and minored in philosophy. I attended East Tennessee State University, Quillen College of Medicine, and completed my residency training in obstetrics and gynecology at McGee Women's Hospital in Pittsburgh, Pennsylvania. I came today to voice my opposition to this bill and to encourage you all to critically consider the outcomes and potential and anticipated consequences of this bill. This bill will significantly impact my ability and the ability of all of my OBGYN colleagues throughout Tennessee to make informed, safe, and private healthcare decisions with and for our patients to achieve the best and desired health outcomes possible. It's important to note that abortions will occur whether or not they are legally accessible. What is important for the legislature is to recognize that worldwide, the highest rates of unsafe abortions are completed in areas with the most restrictive abortion laws and lack of access. And with unsafe abortion comes significantly higher morbidity and mortality in the setting of abortion. 1 in 4 women in the United States will have an abortion in their reproductive lives, and it is vital that this part of healthcare remain legal, safe, and accessible. This bill in particular creates an environment that does not allow appropriate support for our patients and our mothers, sisters, daughters, or friends. The threat of civil lawsuit not only for physicians but also for anyone else involved in helping someone through the decision for their abortion. It is in the best interest of the public to have access to safe abortion services with skilled providers, with support, and without stigma. Outside of the context of access to abortion, this bill has the potential to significantly affect the management of a variety of medical situations, including miscarriage, abnormal pregnancy, and unfortunate pregnancy outcomes, such as pre-viable rupture of membranes, where a woman's water breaks before the fetus is viable. As a physician that takes care of women throughout their reproductive life and throughout pregnancies, patient safety is paramount, and patient safety will be affected by this bill. I can promise you that this bill will affect how physicians and other providers manage things like inevitable miscarriage, wherein a pregnancy may still have cardiac activity, but the miscarriage process is underway and unstoppable, a process in which some women may experience significant bleeding. What happens when a woman's water breaks at 18 weeks, which is not a viable scenario for a fetus that may still have cardiac activity, while the woman is at risk for intrauterine infection, which can develop quickly and progress to sepsis and death? What happens when a fetus has a genetic or structural anomaly that is incompatible with life? These are not straightforward issues, and a blanket bill like this bill undermines the complexity of healthcare issues that may be experienced by pregnant women and their physicians. Thank you, Mr. Chairman.
Do we have questions or comments on the testimony or the witness? If none, we will excuse you. Thank you for your testimony and go back into session. No objections. Thank you, sir. So do we have further comments or questions of the sponsor on the bill as amended? Dr. Terry, you're recognized.
Yeah, I just wanted to get clarification because on the previous question, I just want to make sure it says, notwithstanding another law, a civil action under this section may not be brought against the woman upon whom an abortion was performed. I just want legal, so that the woman could not get
Okay, let me
be part of a civil suit.
No objections will go out of I'll say out of order again, out of session, and we will ask Mr. Bajul.
Rajul Bajoy, Office of Legal Services. Representative Terry, that's correct. Under 3915-224 civil liability, subsection K1 states, notwithstanding another law, a civil action under this section may not be brought against the woman upon whom an abortion was performed or induced or attempted to be performed or induced in violation of 3915-221. So pregnant woman, the woman upon whom the abortion was performed, is not able to have a civil action brought against her.
Dr. Terry, any, okay, further comment? Okay, no objections, we'll go back into session, and we have Representative Freeman, you're recognized.
Thank you, Chairman. Well, I'm sorry if I misspoke, Representative, so I'll ask the question again. So a minor who was raped, and again, 1 in 6 women are victim of rape over their life. A minor who was raped becomes pregnant, they seek an abortion, the rapist, mother, father, neighbor, girlfriend, boyfriend, whatever, decides to sue, the doctor will be responsible for paying a $10,000 fine?
You recognized? Yes.
Chairman, that is correct.
Representative Freeman.
Thank you. One more quick question. So if you're, the way I read the original bill, and we've seen a couple of amendments and this one got filed late, this would allow attorneys and investigators to question anyone who has experienced a pregnancy loss. And the question is, do you believe that people experiencing a miscarriage should be subjected to inquiry and subpoenas for some stranger that believes that they had an abortion? So give you a real world example. Have a close friend who was 4 months pregnant, clearly pregnant, and had a miscarriage. If I believed that instead of a miscarriage that she had in fact had an abortion and brought suit, and again, I know for a fact that the miscarriage that she had was extremely traumatic and potentially damaging to her health. And if your bill passes, I will be able to bring a lawsuit and force her to show up in court to defend herself.
Representative Alexander.
Representative, I think that any time you bring in a civil lawsuit, you must have documentation and proof of an abortion. So you must have documentation that you know it will be taking place.
Representative Freeman.
I think you may not understand what your bill does, because that's not at all what this does. This allows people that have no knowledge, no standing, they have not been harmed, to bring a lawsuit against any doctor that they believe have performed an abortion.
Representative.
That's correct.
Representative Freeman.
So is your intent to bring a bill that allows for someone with specific knowledge? Or explain your intent then, because your explanation a second ago seemed a little off.
Representative.
Sorry. My intent is to bring a bill that protects the unborn life in this state. That is my intent.
Representative Freeman.
No further questions.
Okay. Anybody else have any questions? Speaker Marsh, you're recognized.
I want to ask one. This is not down my area of expertise at all. I don't even like talking about it. But are there any exceptions in your legislation for if you're raped, if the disease or handicapped, to health and welfare to the mother? Any of these have exemptions?
Representative Alexander.
Yes, if a physician says that the mother could die or could be impaired for life or anything, this bill does not apply to that.
Speaker Marsh.
What about the health and disease or handicap to the child?
Representative Alexander.
Are you talking about the baby?
Yes.
That's not born yet? Yes. If a physician decides that a baby is dying or and it could cause the mother's death, they can make a decision.
So,
Speaker Marsh.
So the doctor does have some leeway into deciding the best for both sides, evidently.
Representative.
That is correct.
Thank you very much.
Thank you.
We have further comments or questions on the bill as amended. If Dr. Terry, you're recognized.
Thank you. Again, we may have to go out of session for this, but I just want to clarify this. So you may bring civil liability on someone that performs or induces an abortion in violation of 39-15-221, and that is defined on page 2. And in there, it talks about unless in the physician's good faith medical judgment, termination of the pregnancy in that manner would pose a greater risk to of death of the pregnant woman or substantial or irreversible impairment of major bodily function. So I guess in some instances where there would be an ongoing miscarriage or something like that, does that provide exclusions for those so that you wouldn't be doing a frivolous lawsuit if they were taking care of a patient in that manner? Is that
Representative Alexander?
Can we have a legal answer to that? Because I want to make sure
no
that I'm correct.
objections, we will go out of session and ask Mr. Bojoy.
Rajul Bajoy, Office of Legal Services. Chairman Terry, could you restate your question for me, please?
Mr. Chairman.
Thank you. I'm trying to get clarification on, so civil liability could only be brought civil action against a person or entity that performs or induces an abortion in violation of 39-15-221. And then the way that's defined, the way I was reading it, if the physician is doing something at the termination because of the greater risk of death of the woman or major bodily function, then they would not be in violation by doing that procedure. Therefore, if somebody filed a suit in that instance, it would be considered a frivolous lawsuit.
Mr. Bojoy.
Yes, sir, that's correct. Although whoever the defendant in that case would need to assert that and file a motion of summary judgment so that the court can state that there's no grounds for a civil action.
Okay, thank you.
Further comments or questions that would, yes, Representative Freeman.
Thank you, Chairman. The question that my colleague next to me asked a second ago about the fetus and the viability, and the comment was made that if it was not, that this would allow for it, and that's not the way I read it. Does it call out specifically death or what's the term it uses here? Potential death or of the mother versus the fetus. Does it call that out?
Mr. Bajoy.
So, under 39-15-221B3, the exception provides that if the physician, in the physician's good faith medical judgment, determines that termination of the pregnancy in a manner that attempts to provide the best opportunity for the unborn child to survive would pose a greater risk of the death of the pregnant woman or substantial and irreversible impairment of a major bodily function of the pregnant woman, then the physician can perform or attempt to perform an abortion.
Representative Freeman.
So a non-viable pregnancy that say still had a heartbeat, if an abortion was performed, the doctor performing the abortion could be sued for $10,000.
Mr. Bajoy.
The exceptions under 221B2 and B3 require that there be that the abortion was either necessary to prevent the death of the pregnant woman or to prevent a serious risk of substantial and irreversible impairment of a major bodily function of the pregnant woman. So if those circumstances are not there, then the physician is not able to use those exceptions as defense.
Representative Freeman.
Thank you.
For the comments, Speaker Marsh.
Yes, I'd like to ask legal too. So if there's anything really badly wrong with the fetus, then that's not an excuse.
Mr. Bajoy.
Yes, sir, that's correct. The language of the amendment does not touch on the viability of the fetus.
Thank you.
For the comments or questions of our expert witness, if none, we will go back into session and entertain further questions or comments of the sponsor. If none, we will be voting to send this bill to full committee. All those in favor say aye. All those opposed? No. I think the ayes have it. Is there any objection? Okay. We will move forward with, thank you, Representative Alexander.
Thank you, committee.
That
Thank you,
was your
Chairman.
long-awaited agenda. We got 5 minutes left. Representative Griffey, I think you're recognized on item 16, 2314. Do we have an amendment on that?
Yes, there is.
I'd ask for a motion and second on the bill. Have a motion and second on the bill and a motion and second on the amendment. Did you get the number on it?
It's 15646.
15646.
Yes.
Okay.
Yes, Mr. Chairman, that's what I have
So
too.
we'll be voting on the amendment. All those in favor of the amendment say aye. Any opposition? So approved. We will let you describe the bill as amended, sir.
Thank you very much, Mr. Chairman, members of the committee. What House Bill 2314 as amended seeks to do is currently under Tennessee law, if someone commits abuse against a child, it only applies to a child that is actually living, has been born. It doesn't apply to babies inside a mother's womb. And as an assistant DA, and this bill was brought to me by an assistant DA, the problem is we have women who are addicted to drugs and they're harming their babies, and it's causing NAS, neonatal abstinence syndrome, and they end up going through withdrawals in the hospital, and the taxpayers are paying for this, and there's nothing a prosecutor or law enforcement can do about it until after the baby's born. And if the baby's born and they took the baby home and they were using methamphetamines or opioids around the baby and it got into baby's blood system, they could be prosecuted, but you can't do anything right now. The amendment does make an exception for any valid medical procedure, in vitro fertilization, any other authorized medical procedure, so it would exclude those. I did want to add an amendment, and I didn't get it, and if we go to full committee, maybe the committee might want to do it, that would also make an exception for that if a mother comes to, tries to get rehabilitation services, they could not be charged under this. So that's essentially what the bill's amendment trying to do.
Okay, do we have comments or questions of the sponsor on this bill? Dr. Terry, you're recognized.
Right. Thank you, and that was, we used to have, I believe, a fetal assault bill that sunset, I think, in 2016, and the issue, I think, that we had with that was that it decreased women getting prenatal care because of that, or increased the risk of abortion, and so of course, you don't have a timely filed amendment, and that's that might address the concern. I just don't know on that. Your comments on that.
Well, if we're
you're recognized, sir.
Well, and if we're out of time for today, I know it's been a long day for the committee, and we need to come back next week to vote on this. I could have an amendment ready, or if you want to consider it and do it and get it in full. I wouldn't proceed without that amendment on it because I think it's important. We don't want to discourage people from trying to get rehabilitation services, but at the same time, we don't want to allow mothers to keep harming their babies and them ending up in the NICU for weeks, going through withdrawals. And we need to try to we've got a carrot and a stick approach, I guess, to this problem. So anyway.
Okay, do we have a motion from the committee to roll this to the heel? We have motion and second to roll this to the heel. All those in favor say aye. Any opposition? So we will roll this to the heel, and you will be able to amend it.
Thank you very much, Mr. Chairman, members of the committee. Thank you.
Okay. The remaining balance of the bills we will forward on to next week. And then I'll stand for a motion to adjourn. Have a proper motion and second. All those in favor say aye. So approved.